Good afternoon. Ooh, sorry, did not mean to yell at you. Good afternoon, everybody. Thank you so much for joining us. Thank you for your being here and spending some time with Peach State Health Plan. We are going to tell you about some of the great things that we do. So please sit back, enjoy, prepare your questions should you have any, and we will be able to give you lots of information. First up is going to be Brian Bong. He is going to talk to you about our population health services.
All right, let me adjust this. All right, good afternoon. My name is Brian Vaughn. I am the Director of Population Health Strategy for Peach State Health Plan, and today I'm going to provide information in relationship to population health. But first, I want to give you some information about Peach State. We are a NCQA accredited organization. We have around 817 local employees. We have been a care management organization since 2006. We have over 700,000 Medicaid members, and we are a subsidiary of Centene Corporation, which is a Fortune 25 organization. So once again, my name is Brian Vaughn, and I'm going to talk to you about population health and what we do as a department, specifically around care coordination and care management. As you can see on the screen, care coordination is a set of member-centered, goal-oriented, culturally relevant, and logical steps to assure that members receive the care that is needed for them to be healthy. And notice it says that it is supportive, effective, efficient, timely, and cost-effective. Our care coordination model is built on 4 pillars: care management, disease management, transition of care, and discharge planning. Contrast that with care management, which is a pillar of care coordination. Care management is a person-centric, collaborative process of assessment, planning, facilitation, and advocacy for options and services to meet individual health needs through communication and available resources to promote quality, cost-effective outcomes. Care management serves as a means for achieving member wellness. Right? Our motto is for members to get well, to stay well, and to be well. We have interventions under care management that help our members do just that. So let me break down the 4 pillars of care coordination. Number 1, you have case management. Case management is an appropriate for members with clinical and or behavioral conditions needing a higher level of service. Right? So these are individuals that have been identified as needing specific case management services where we work very collaboratively with those individuals to provide them the service and care that they need. Next is disease management. Disease management is appropriate for members with chronic conditions to include but not limited to hypertension, diabetes, asthma, substance abuse, and depression. Our transition of care is appropriate for members who are between health care practitioners and or settings, as their conditions and care may change over time based upon their chronic and or acute illness. And lastly, our discharge planning is appropriate for members who are discharging from an institutional setting. Our goal is to ensure that they receive the right care, the right resources during that transition period. Within population health, we have specific teams that manage each of these different pillars. Dedicated, highly trained individuals that work with our members day in and day out to ensure they receive the care that they need. Our integrated care model is built on our systems of care approach. Once again, our system of care approach is collaborative. It is highly integrated with specialized, highly trained individuals that work collaboratively with the member to ensure that they're receiving the care that they receive. You can look at this diagram and tell the member is the center focus. They are the individuals that drive everything that we do. And on the outside are the individuals that work with that member to ensure that they receive the care that they need. This next slide shows you some of the programs that we have from a case management perspective. We have women's and maternal health, and some of the programs that live under this would be things such as Start Smart for Your Baby, Notification of Pregnancy, and our MOMS program. Under the complex care management, we have our Sickle Cell Center of Excellence. We have our chronic condition management for asthma, diabetes, hypertension, et cetera. And we have our digital care management team. Under behavioral health, we have a dedicated behavioral health team within population health to oversee all of our behavioral health issues that our members are facing day in and day out. We have programs such as the HALO program, our Choose Tomorrow program, that are available for our members with behavioral health. And under social determinants of health, we have our community advisory boards, which is a statewide partnership. We have our social determinants of health platform, Find Help, and we have our community command hotline. If you're looking for ways to contact our case management, care management department, this slide shows you the mediums that you're able to use in order to contact our department. It shows you we have phone numbers, we have websites, email, we have a portal, provide a portal that you're able to access, and also our hours of operation. The same with our SDOH, how you are able to make a referral to our SDOH department, how you're able to access our community health line, and our resources for our social determinants of health. What questions do you have for me at this time? Okay, if you have questions, I'm going to ask my amazing nurse clinical liaison, Rochelle Raleigh, to be able to answer those questions for you. She's sitting right here in the front. So if you do have questions as you think about them, you can get in contact with Rochelle Riley. Thank you very much. And next, I will introduce Shanita Neal, who will talk about our value-added benefits.
Good afternoon. My name is Shanita Neal, and I am the manager of member retention. And I'm going to step back a little bit because I'm from Central Georgia, and I'm a Georgia peach and a country girl, so I may be a little loud. So work with me. With our value-added benefits, they are very important to our members because of the fact we believe in transforming a community one person at a time. So when we select our VAPs, we take in consideration the entire family. So let's talk a little bit about what we do at Peach State. Now, starting with our adults, we ensure that they have the adult dental, the adult vision. Those are good benefits, and they're for members that are over 21. As well as we have over-the-counter catalogs that's up to $180, and the members can pick that up at the store or they can order online. And this is for participating CVS locations. No pharmacy prescription is required. As we know, maternal health takes very essence of the heart of Georgia. Therefore, Peach State Health Plan is committed to our healthy moms and babies, in which we do provide electric breast pumps for our breastfeeding moms, as well as we have a mommy store designed for that mom that completes her postpartum and prenatal visits, as well as we have a mom's meal. This is 2 daily meals with nutrition. We do nutritional counseling, prepared and sent to their homes for up to 30 days. Also, everyone knows about our baby showers. We do those statewide, and we have gifts and tips to stay healthy and a chance to win great prizes. Let's get back to what we do for adults. As far as our adults, we do offer memberships, which includes Amazon, BJ's, Costco's, and Sam's. This is an annual memberships, gym memberships for ages 13 and up, choice of a gym at participating gym statewide and in-home videos. So what do we do for our children? It's very important that after-school care, that children have this interaction to stay healthy. We did this summer offer summer camps. We were the first CMO in Georgia to offer summer camps in collaboration with Boys and Girls Clubs for ages 5 through 12, as well as our Boys and Girls Clubs yearly membership. Something for the family that we do is our YMCA family memberships at participating clubs. Something great that we do to try to enhance with the recreational centers in your community, as well as ours, is our youth activities. Peach State offers up to $100 towards STEM programs, after-school activities, as well as those sports activities that occur at your parks and recs. Now, what we also offer is our Boy Scouts and Girl Scouts vouchers. Now, let's talk about going to the doctor and being healthy. We offer Wellness Win rewards for those that complete those wellness visits, as well as we have youth raffles that we do quarterly. And they are done in each region where the member has a chance to win iPad, an Apple Watch, PlayStation, and other fun things. Not only that, but we want to see everyone succeed. So we have a Steps to Success program in which we do take care of GED exams. And something great that we've done for the last 3 years, we do our college and job training scholarships that are worth $10,000. Also, we do for our kids that are graduating from high school, we do the college dorm room supplies, those kids that are going off to school. And also, and much more, we take care of those patients that may have asthma with hypoallergenic bedding. We do pay for that. At Peach State, we do believe that what we do transform one person at a time, and we are making an impact. We now offer Peach State Healthy Days Wellness on Wheel program, in which our next event will be in Columbus. If you do not see us there, most of the time we are statewide, being led by Noria Johnson, wave your hand, up under the supervision of our Vice President Sojourner and Carletta Young. So anytime you see Peach State, just know that we are making a difference in the community, and we hope to see you soon. I'm going to turn it over to Remy now, and she's going to talk to you about behavioral health. Thank you.
Good afternoon again. I'm Remy Rodriguez. I'm the Vice President of Behavioral Health Operations for Peach State Health Plan. Again, welcome and thank you for coming to our session. I have the pleasure today to talk with you about mental health parity. And I'd like to talk about, to start out with the history and the framework of mental health parity. As you can see from this very busy slide, we've been thinking about mental health parity since 1996, when the first federal law around mental health parity was started. And since then, what has happened has been a natural progression of more and more integration of behavioral health to everything that we do, and more focus on bringing more services to our members when it comes to mental health. We've also used federal parity laws to not only focus on mental health for our members, but also to report, do some analysis as to where members are as far as their mental health, and bringing that into light and seeing on ways we can serve each and every one of our members better. As you heard from our colleagues, mental health is in everything that we do, and population health and our benefits. So when we do something at Peach State Health Plan, mental health and substance abuse are front of mind. We're fortunate that in Georgia, the legislature in July 2022 also passed the Mental Health Parity Act that gives additional additional benefits around mental health parity. One of those, it requires us to have mental health visits allowed at the same time as the PCP visit. This is something that we've been doing even prior to the law, but it's something that has brought focus again, bringing in mental health into everything we do. A whole person focus, so health is looked at holistically. The Georgia Mental Health Parity Law also expanded the medical necessity criteria or medical necessity definition. And as you'll see later, it brought in some additional components such as prevention. And I'll talk about that a little bit later. It also required mental health parity reporting to be published. So today you can go to the DCH website and be able to see mental health reporting around, mental health parity reporting around all the things that we do to keep mental health as the primary focus for our members. And then it also brought into an opportunity for a provider such as yourself or members to reach out to the health plans and also to DCH and ask any questions or offer any concerns that you may have around mental health parity. Our provider relations specialists that I hope you talk with on a regular basis are always available to answer any questions that you may have around mental health parity, as well as MI. So what does mental health parity mean? Should we understand about mental health parity, and should our providers and members know? First, and one of the biggest tenets of mental health parity is that the focus is on making sure that mental health benefits are equal to or greater than our medical benefits. And that can be measured with many things. It's measured with the type of benefits that are offered, and we ensure that our mental health benefits are the same or equal to medical benefits. This includes ensuring that we have inpatient care, residential treatment care, outpatient care, comprehensive at all levels, including in-home care for mental health, and not only from our licensed therapists, but also from peer support that can help our members understand and navigate the mental health system. Additionally, it requires that any financial restrictions, such as out-of-pocket and copays, are the same or at least less restrictive than medical copays and financial limits. So for copays, out-of-pockets, and even the number of visits that our members have, they're unlimited, and the copays are minimal. And providers are encouraged and asked that they do not limit providing mental health services to a member because they can't pay the $2, $3.50 sometime copay that it requires. Additional mental health parity talks about certain non-quantitative measures, things that you can really measure with a report or by counting certain stats. It looks at things like authorization and ensures that authorizations are not more restrictive for mental health than they are for medical. And this has been something that Peach State looks at on a yearly basis. We look at all our services and look and see if we're authorizing the services, if a service has an authorization most of the time, and if so, we evaluate to take those authorizations out. We also evaluate on a yearly basis to ensure that mental health benefits do not have any more authorizations or restrictions than the medical benefits. Mental health parities, like I mentioned, also particularly the Georgia Mental Health Parity definition brought additional elements into the medical necessity definition. And that includes prevention, screening, and diagnosis and management or treatment that is focused on minimizing the progression of illness, conditions, and symptoms. So you say, what does that mean to me, right? And what it means is that mental health should be preventative. that mental health starts when the child is born, and it progresses through a lifetime. Because different mental health, not only because of social determinants of health, but also just of disease progression, mental health is very co-occurring with every stage and component of our lives. So we encourage our PCPs to do screenings very early on for things such as ASD, mental health issues, and substance abuse. We also encourage our members to seek help. So when members there's no need for a referral, they can go and seek services without a referral. And authorizations are not required for any psychiatric visit with a physician. They're also not required for any diagnostic visit, and they're not required for initiation of treatment, meaning that members can receive therapy, outpatient therapy, without any authorization. The other component that you look at when it comes to mental health parity is looking at reimbursement. And what mental health parity requires is that reimbursement is equal to or greater than medical providers. So we look at our reimbursement rates on a yearly basis, and we ensure that we're fairly paying our mental health providers as we are our medical providers. Another tenet of mental health parity is advocacy and education. Not everybody knows their rights around mental health parity, and one of our aims is to ensure that not only our providers, such as you, but our members are well-versed around mental health parity, and that you help us engage members in understanding what their benefits are and what their rights are for mental health services. So we do that through our provider relations team. We do that through our website, and we're expanding that on a daily basis. And we encourage you, many of you, I've seen websites that you have that are wonderful, that talk about what mental health parity is and what members can do to advocate for themselves. So we encourage you to put that on your websites, as well as we do annual monitoring of our compliance with mental health parity. I would now like to shift and talk a little bit about all the great things that mental health parity has brought in recent years, and all the great things that Peach State is actually doing to promote access and promote our members' health around mental health and substance abuse. First, we all know that there's been a workforce shortage in Georgia when it comes to mental health. So Peach State has partnered with the Medical College of Georgia to provide grants for physicians, including psychiatrists, to be able to develop the aging medical workforce for psychiatry in Georgia. We've also partnered with Georgia Southern University to also provide scholarships and grants for the development of nurses, which we know is a shortage, but also mental health counselors and therapists. We've also looked very closely at what are our unique needs of our members and developed programs to meet those unique needs. I'll start by highlighting PICS. We all know that during the pandemic, our youth have experienced great loneliness. They've become more focused on their computers, their handhelds, and talking through TikTok than they have in developing relationships with their schools and other kids. So one of the programs we started is PICS. PICS is a preventative program that will outreach our youth, members 13 to 18, and they will provide an app where they can interact. They'll also do social determinants of health screenings. They will do depression screenings, so the PHQ-4, and also loneliness screenings. And based on their needs, they will refer to different organizations to assist with their social determinants of health. They'll also refer to mental health providers in the community, and they'll refer members to our case management team that could more deeply assist with their needs. But one of the important components of PISC is that they'll have a peer on the other phone that a member can talk to for as long as they need and be able to assist with any issues that they're dealing with at the time. Choose Tomorrow is a evidence-based program for suicide prevention. As we all know, many of our members are at risk for suicide. So in order to wait till something happens, we actually look at all of the data of our members, use a specialized algorithm that determines those members that are at risk for suicide. And then we have a team that outreaches those members, provides services, and even offer mental health care. So this is a very important program that does prevention and ensures our members are getting the behavioral health their behavioral health needs met. HALO is a very similar program, but for substance abuse. We do the same type of data mining through algorithms to find members that are at risk for substance abuse and do screenings and prevention counseling, and then offer help when they need it. We talked a little bit about the shortage of providers in the state. So one of the things we've done is contract with Growth Therapy. They're an integrated model for behavioral health services. They have both in-office visits, but as well as telehealth. We were able to bring an additional 265 providers into the Medicaid network that can offer care for our members. School-based clinics, as we know, we've talked a lot about it, and we're fortunate that we have people like Avita Johnson, who's done a lot of research on school-based clinics and its effectiveness. And so in order to continue to promote school-based clinics, Peach State has donated $1.1 million to the Primary Care Association so they can continue the good work they are doing in expanding school-based clinics across the state. And finally, we want to incentivize our providers for all the great work that they do with our members around mental health. So we have a value-based program that we encourage our providers through financial incentives to identify those members that need help, maintain them in services, and prevent higher levels of care such as emergency rooms and inpatient care. Thank you for listening to me. I'm Remy Rodriguez. I can be reached at 954-560-7757, and I appreciate your time this afternoon.
Good afternoon, everyone. My name is Jennifer Morris, and I am the Provider Relations Trainer at Peach State Health Plan. So I'm going to go over with you today several different topics, and we're going to take it home because I know you're all looking at Halloween. You want to go get those kids ready to trick or treat. So let's get started. All right, so I'm going to talk a little bit about some of the provider resources and tools that we have for our provider network. We have several different things. We have different coordination teams within the health plan. We have different tools that you can utilize. So one of those first things is dedicated provider engagement administrators. Each individual county within the state has its own PEA, or Provider Engagement Administrator, as well as a manager. We have a provider servicing team. We have online provider training library that is located on the Provider Secure Portal. We also have provider communications. We have a clinical team. We have community health services team. We have provider practice HEDIS education team. We have one of our tools is Centene Clinical Action, which we have just recently rolled out. One of the other things is, of course, a risk adjustment education team, as well as I mentioned earlier, the Provider Secure Portal. We will be transitioning over November the 18th to Availity. We have listened to provider comments and feedback, and we just want to make sure that you guys understand that we do take your comments very seriously. We take your feedback very seriously. So one of the things that we have implemented is transitioning our secure provider portal over to Availity. one less tool that you have to worry about using a password, a username, going in and out of different systems. You'll have everything that you need right there in Availity. Through Availity, if you are already a registered provider with Availity, you should see Peach State Health Plan as an option. If you are not, you can register for Availity, and once you're registered, then you will see Peach State Health Plan as an option there, and you can pin it or save it, and that way you won't have to search for it every time. You will have the same functionality on the Availity website that you currently have on our Peach State Health Plan secure portal. These are some of the items that you will have at your fingertips, where you can view member demographic and medical history. You can view the member's authorization history. You have member care gaps. You also can submit claims, correct them, and do reconsiderations on the web, as well as look at your payment history. And you can also email the health plan via the secure email functionality on there as well. Now, through Availity, you also have Availity Essentials. This is where you have the ability through two different applications. One is the clinical quality validation application, and then you have the risk condition validation application. Through these two applications, you have the ability to view and respond to payer for clinical data. You can, it's intended to help support the providers and payers by documenting the completion of care opportunities. You are assigned care opportunities or patient measures can be viewed prior to the visit with the patient, and you can document in the CQV from any updates. Now, your provider engagement administrators, or you will hear us call them PEAs, they are your primary liaison between you as the provider and our health plan. Those individuals are responsible for helping to coordinate any provider education, updates, and training. They are also responsible for helping to clarify any clinical and payment policy reimbursements that you may have questions about. They will assist you with updating any of your demographic information, member and provider roster questions. They can also assist with web portal registrations, and they can also assist you with any questions you may have around completing your appointment agendas. Now, some key points of contact. The state for us is divided up into 6 different regions. Each region has its own manager and provider engagement administrator. All of this information and a territory list can be found on our website. The Provider Relations Territory List is under the pshpgeorgia.com. Now, one of the other ways that we have as staying in constant communication and contact with our providers is through provider email blast. Currently, so far this year, we have sent out approximately 85 email blasts to our providers. Within those email blasts, it is a lot of different topics. One of the main ones that we do annual, quarterly, and monthly provider education training topics that we have. That does consist of planning for healthy babies. It also consists of your appointment availability and access standards. We also send out information through email blast about clinical and payment policy updates, any type of authorization updates that we may have at the health plan, training webinar notifications, which occur on a monthly basis. They are held every month, but once a month between 1 and 2 o'clock in the afternoon. Usually it's the last business day of the month unless it falls on a Saturday. It's the last business day unless it's a holiday. But we do send out email blasts for those. I usually try to send out 3. So you'll get the first one and then two reminders. So definitely be on the lookout for those. We do have educational and information documents that are sent out, as well as HEDIS tip sheets. Now let's look over our provider incentive programs. The provider incentive programs, the P4P program, the objective is to enhance the quality of care with a focus on preventive and chronic care services. For those eligible members, those members who are eligible have been assigned to a provider, and all provider groups with assigned membership qualify. Oh, sorry about that. Go back. Performance incentive, there are targeted measures that represent Georgia's Medicaid population. There is a combination of 12 pediatric measures and 13 screening and chronic condition measures. Now, the measures are selected by each state based on the state targets and NCQA focus. Some of the other provisions for this program, there are 3 reporting cycles. We have the payments that you receive are above and beyond any contracted fees that you may, payments and fees that you may receive. The measurement period runs from January the 1st to December the 31st of each year, unless it has some type of different cycle, measurement cycle. The providers do not have to have any type of contract amendment to participate in the program. There are 3 tiered targets. They are low, medium, and high, and each threshold pays an increased percentage. There are additional opportunities for additional bonuses if the provider is PCMH certified. Some of the other programs that we offer, one is the Fall Push program, and that is actually offered in the latter half of the year, focusing on key measures with payments per transaction. We also offer an additional incentive for CPT2 coding. We have the Notification of Pregnancy program, as well as the value-based programs. And we do know that it's important to get members engaged and to have the member engagement. So here are some of the things that we do as a health plan to make sure that our providers are engaged. So we do reach out to them in various ways. Some of those are telephonic outreaches that are made from the provider's office. We do have text campaigns. We have emails and letters that are sent. We also do in-person events. That can be meeting the members where they are. That is a very important component of member engagement. So we do exclusive Peach State Days. We have our mobile van units. We also have baby showers and collaboration with other partners. And we also have incentives for outreaching to those individuals, members who are non-compliant, just to offer some type of small incentive to kind of push that motivation to get them to go see their doctors so that they get the care that they need. Now I want to talk a little bit about the incentive program, the COC program. This is designed to support your outreach to members for annual visits and condition management. This will help us to identify any of those members who are eligible for case management. This also increases our visibility into those members with certain medical conditions for better quality of care and chronic condition management and prevention. They can earn bonus payments through for thoroughly addressing those conditions. And the COC program is in addition to any additional payment that you may receive from the health plan. Providers are eligible for a bonus for each completed appointment agenda, along with verified and documented diagnosis. And the chart at the bottom of the screen there, you will see that there are 3 different thresholds, and there is a bonus for paper, and then there is an increased bonus if you submit the information electronically. So there are 2 different ways that you can submit the appointment agendas and the documentation to the health plan. The first option that you have is through logging into the Secure Provider Portal and going into the COC dashboard. Within the COC dashboard, you will be able to find your appointment agendas, complete the appointment agendas, and submit those to the health plan through the portal electronically. You can also print those appointment agendas. Once you print those, then you would sign and date them and submit them to the health plan, either by faxing to the number that you see there on the screen or by sending them to the email address that you see there as well. Then you will submit a claim or an encounter containing all of the relevant diagnosis codes. So that does complete our presentation for the day. And we provided you with a lot of good tips, a lot of good information. And now we want to know what questions you have for us.
Good afternoon and
Good
happy
afternoon.
Halloween. I am wondering, we offer ABA services and autism diagnostics, so I'm wondering on the prior authorization form, are wet signatures required or are electronic signatures with date and timestamp acceptable?
Can we take that back? I believe the web signatures are not required, but I'd like to take that back so I don't give you bad information. I'm going to come and give you my card.
There's actually an email in your inbox, and I'm attached to that because I asked the question to all the providers in there. So yes, you already have that question in your inbox. So as soon as you get back to me, that'll be perfect. Thank you so much.
Thank you.
I have a question on behalf of all the children. My clinic provides OT, PT, and speech, and we have an ongoing issue with the requirement to submit a hearing screening for our speech authorization requests. We have many children with special needs and with autism that cannot participate in a traditional hearing screening. I have a Peach State member right now that has had 4 attempts at a hearing screening and is now facing being put to sleep to have his hearing tested in order to submit to your plan a hearing screening. I would like to propose the use of the Music to My Ears screening tool that is very useful for children that cannot participate in a traditional hearing screening. As an alternative, we've attempted to submit this in the past and have been denied. So I would just like to request that we be able to use this as an alternative screening tool for those children.
I think Dr. Richardson's.
Thanks for sharing that, and I know you presented it earlier at one of the other CMO presentations. We'll certainly take it back and take a look, and we're always trying to do whatever it takes to improve the health of our members, so please share. Yeah, I'd like to get more information about, the application you have, as well as your contact information, and we'll review it internally with our experts and certainly respond. Thanks.
So I understand that Involve Dental has changed to Centene Dental. Is that correct?
Centene is our parent
Is
company.
our-
We are a
okay.
subsidiary of Centene Corporation.
Okay, so do we still bill our claims to Evolve or Centene Dental?
They go, none of that has changed. Yeah, none of that has changed.
Okay, because I
Yeah.
called a rep and they said to bill to Centene Centene Dental as opposed to continue to bill to Evolve yesterday.
She's bringing your mic, Brittany.
So we had a representative at the table. So let me see if she's still here and I can. Oh, they've left the table already. Okay. Do you have your contact information that
I
you
do.
can give to me? And then
Sure.
I'll get back to you on that.
Awesome, thank you.
You're welcome.
All right, well, that is it. Thank you all so much. Oh, and she's holding up back there the surveys, so please don't forget to turn in your surveys. We appreciate it. And thank you all so much for your attention and safe travels.